Dear ladies and gentlemen, dear colleagues, we greatly thank the organizers of the conference for the invitation and for the opportunity to tell about the methods which used in Ukraine for the rehabilitation of combatants and civilians.
So, the topic of our report is Biosuggestive therapy in the correction of mental trauma. Due to the war started by Russia, the citizens of Ukraine constantly suffer from stressful factors related to the aggression of the neighboring country. The psychotraumatic agents increase stress hormones, impact neurological regulation of organ and system functioning, and disrupt humoral homeostasis, which leads to the emergence of symptoms of different diseases. As a result, methods of quick and effective recovery of combatants and civilians after acute or chronic mental trauma are especially in demand in Ukraine.
In previous years, Ukrainian specialists received valuable experience from colleagues from the USA, Britain, Israel, Austria, and other countries. We sincerely thank our colleagues for the trainings which allowed us to understand their methods of correction and treatment of acute, chronic, and complex mental trauma. But we faced the fact that some Western methods do not pay enough attention to the realities of the current war in Ukraine, which has its own features.
Taking into account the experience and knowledge of our foreign colleagues, Ukrainian specialists developed our own methods for working with trauma. They are adapted to real existing needs and are complementary to the experience of world psychotherapy. The purpose of psychological intervention in cases of adaptation disorders and numerous neurotic diseases in the context of chronic distress is the prevention of psychological maladaptation and psychosomatic problems. So, one of Ukrainian methods is biosuggestive therapy, created for quick coping with the stress implications and mental psychological trauma.
This method has existed for 30 years, but its effectiveness was especially evident in the work with Ukrainian combatants and the civilian population, precisely during the invasion of Russian troops into Ukraine in the past 3 years. Method BST is recommended for practice by the Ukrainian Institute of Psychology, by the League of Psychiatrists and Psychotherapists, by the Department of Psychology of the Military Institute of the Ukrainian National University, and by other professional and scientific institutions. The Ukrainian Ministry of Veteran Affairs included the methods of biosuggestive therapy in the list of body-focused psychological interventions necessary for the rehabilitation of Ukrainian combatants.
So, biosuggestive therapy, or BST, is the method of psychotherapy and psychocorrection born and known mostly in Ukraine. In Ukraine, BST method was introduced and described by Alexander Strashny, the Ukrainian psychiatrist and psychotherapist. What are the features and benefits of BST method? Why is it needed if many other exists? First, BST is highly effective method. After the first course of BST, 8 sessions are recommended usually. Most of the patients feel better. Depending on each personal situation and anamnesis, from 30 to 60% of our patients completely get rid of their complaints. Second, the method does not cause any of addiction from the method of BST and from provider. BST does not induce complications and adverse effects. Short course of therapy is needed, so not more than 8 sessions for the complete result obtaining. Sessions could be individual or in group. It does not take much time to master the BST method. Just few days are enough for the psychologist with basic education to learn how to use BST method in his own practice. Provider can use BST separately or as a supplement to another therapeutic methods. And last, BST gives a positive effect not only to our patients, but also on the providers.
Psychologists are attracted by the simplicity, efficiency, and logical clarity of this method. Combatants are attracted to the method because they do not need too much so-called to open up to a psychologist. Let's look at several reviews of specialists who use the BST methods in their practice.
Many people who have experienced the consequences of psychotraumatic events have certain disorders of the psychosomatic spectrum. Biosuggestive therapy is precisely the number one method in dealing with these disorders.
We built
the whole system as follows. The director of our center said that it is the task of our psychologists and doctors to refer all the patients to biosuggestion, because this is the only most effective method that helps quickly and efficiently.
Our patients value BST the most. With all due respect to colleagues who are engaged in cognitive behavioral therapy, EMDR, and I also do this, cognitive therapy doesn't work. Combatants have reduced memory, reduced attention, concentration, and when you start giving them some homework, they will not come to the psychologist with their own consent.
More than 90% of my patients see improvement after the first session.
Doctors also come to me for biosuggestion, and I completely believed in this method when my doctors visited me for a session and said that it was very cool.
I was surprised when the director held the meeting and said, "Everyone to Poltavce. Let him carry out biosuggestion to the maximum, because it is the best tool." When combatants complete rehabilitation, they are asked, "What did you like best? What gave the greatest result?" And most of them say, biosuggestion.
It's the same for us. Biosuggestion is the number one choice. If the patient is told that we will work according to the protocol of cognitive therapy and you will do homework, then no one will do this. Maybe only a few. On the EMDR, work is going well according to the protocol of recent events, but it is not for everyone. No need to say anything, because they can just sit back and relax. After the session, you don't need to say anything either. You can only give feedback about good things. And they themselves ask me when the group would gather for the next session.
BST is indeed an effective evidentiary method. This is the main thing.
What are the methods of biosuggestive therapy? It is clear from the title that the psychotherapeutic technique uses suggestion. But in the BST method, suggestion is not only verbal, by words, but also non-verbal, with the help of special overtones of the therapist's voice and real or imagined touching of the client during the session. A therapeutic session of biosuggestive therapy has 3 parts. The first part is individual conversation with the client. It is conducted with each client at the beginning of the session. The structure of the conversation is built so that the negative neurotic pattern of the client might be changed to a pattern of well-being. The second part is working with groups, is group induction. With a group, the result of the therapy is better because in this case, there is a positive influence on the new members of the group by those clients who have already passed several sessions and experienced a positive result. The third part of the session is therapeutic biosuggestive meditation. It is built according to the rules of classical suggestive therapy with some modifications. Firstly, we don't try to put the client or clients into a state of deep trance. Our experience shows that the depth of the client's trance during the session is not too much important. To achieve a good therapeutic result, the trance may be light. Secondly, the voice of the therapist with background music sounds in the audio recording. Audio recording allows to use a carefully edited text that contains everything that is necessary, but there is no a single unnecessary sentence, not a single unnecessary word. And thirdly, during the session, the therapist touches the client or clients in a certain rhythm. Touching is not an obligatory component of the session. It is used only in cases when the client agrees to it. The total time of the session is 30-40 minutes. The duration of meditation is 18 minutes.
So, who needs BST? Whom, for which clients BST recommended? We recommend BST for people with acute or chronic trauma and with the presence of psychosomatic complaints. The BST is an effective method for eliminating symptoms of different disorders, decreasing the effects of stress, asthenia, chronic fatigue, feeling of internal tension, anxiety, fear, irritability, memory loss, impaired concentration, headache, and various types of pain syndrome, such as pain of unexplained origin or arterial hypertension. Main manifestation of mental trauma for BST correction are sleep disturbances and insomnia, as, for example, dizziness, incomprehensive sensations of the heart area. From physical symptoms, headache, pain of incomprehensible sensations in the heart area, in the abdomen, migrated pain in the spine, functional disorders from different organs. The main demands before we are starting BST therapy is complete investigation of our patients and doctor's consultation.
Contraindications for biosuggestive therapy. The BST methods cannot be used without a medical examination. We must be sure that the patient doesn't have any disorder that requires medical intervention, not psychological. Second, it is contraindicated to work with clients who have acute paranoid symptoms or are in a state of alcohol or drug intoxication. Patients with flu-like symptoms are not allowed to attend group sessions. In the case of online therapy, the patient cannot listen to the therapeutical meditation while driving the car. And it is not allowed to use BST meditation for combatants in the zones of active military operations.
Mechanisms of BST action. The therapeutic program or the BST sessions consist of series of biosuggestive structures. During this session, due to being in a light trance state, the parasympathetic nervous system is activated in the patient, so the painful neural patterns responsible for the perception of disease are extinguished. And as the neural connections that contain the image of well-being are strengthened. The body's hidden reserves are activated and self-regulation processes are increasing. Suggestive structures that the patient perceives during the session in this trance state also decreasing hyperalgesia, increased sensitivity to pain. This lowers the thresholds of emotional and physical pain, improves the work of autonomic nervous system. Similar results are correlated and explained in terms of Porges' polyvagal theory. Different musical compositions can improve the possibility of individual approaches for work with each specific request.
Depending on the client's condition, taking into consideration the symptoms of dysfunction of the sympathetic or parasympathetic nervous system, as well as according to Stephen Porges' polyvagal theory, BST uses different models. But in the cases of comorbidity, or when the patient's condition regarding active or passive survival is not clear, we use an universal therapeutic BST meditation session.
Scientific verification of BST results. The BST method had passed scientific verification in the leading medical universities in Ukraine. 16 studies were conducted. According to the research results, 24 articles were prepared, which were published in scientific journals of Ukraine, Poland, Lithuania, and the USA. Now, we will present the main conclusions of the published works.
The effectiveness of biosuggestive therapy in reducing the severity of pain syndrome in patients with both psychoneurological and dental problems was proved. The maximum changes were observed in the emotional component of the pain syndrome. The method of biosuggestive therapy is effective for the normalizing of emotional state of patients before a visit to a dentist. The use of biosuggestive therapy in the complex treatment of patients with anxiety and mixed anxiety depressive disorders has a positive effect on the feeling of psychosocial well-being. The BST method is an effective tool for the correction of psychosomatic disorders caused by the consequences of the post-COVID syndrome. The study provided high efficiency of biosuggestive therapy using the complex treatment approach of emotional disorders in patients with type 2 diabetes mellitus. The implementation of biosuggestive therapy into the rehabilitation process effectively contributes to overcome depressive and anxiety symptoms, reduces stress, normalizes sleep, and improves the subjective perception of the quality of life in internally displaced person. The BST methods can be used to correct various psychosomatic and stress-related disorders combined with functional and chronic diseases, endocrine pathology, behavioral problems of childhood and adolescence.
One of the examples of our last investigations where we applied the BST method for the residing in the deoccupied settlements of the Kiev region, April to July 2022, so it was the early phase of the opening intervention of Russian troops into Ukraine, focusing on their gastrointestinal complaints. The hospital anxiety and depression scale was administered to group with average age 53 years old. Anxiety and depression were found to be clinically significant in 94.4% of treated individuals. They were combined with other significant complaints. In addition to headaches, joint and back pain, 59% of patients reported worsening sleep and insomnia, and 45% reported digestive complaints. After the first session in group, patients reported feeling better overall and in better spirits. So they indicated to desire to continue the complete therapy course, 9 sessions. And our publication summarized the findings of 5 BFT sessions. During this period, the heart anxiety level decreased from 24 to 18. And sleep quality improved and normalized in 67.7% and 21.1% of patients, respectively. On the visual analog scale, the intensity of abdominal pain dropped from 6.6 to 2.2 after 4 or 5 sessions. Some patients even reported that the pain vanished during the session completely. According to what patients have noted, the course of BST assists in redirecting patients' focus from distressing thoughts and emotions to therapeutic ones, those that are suggested during the treatment sessions and help lower visceral anxiety. Patients with functional diseases of stomach may benefit from more potent and long-lasting beneficial therapeutic effect when the BST technique is combined with complex treatment carried out in accordance with clinical protocols.
The full text of the articles have been published in scientific journals as well as in the manual Biosuggestive Therapy scientific articles. The manual can be downloaded from our web page.
The use of biosuggestion therapy needs further researches with regard to different manifestations of diseases, especially mental trauma, which should be presented in the nearest future. And we hope we can do it together with you.
We are grateful for the Institute of Complex Trauma for seminars, trainings, and supervision. We are personally grateful to the director of the Institute, Mr. Dmitry Karpuk, for the practical advices that allowed us to adjust the BST method to the requirements of world psychology. It is impossible to explain all the details of using our method in this small conference presentation. For psychologists who wish to learn more about the BST method and possibly master it, with the permission of the Institute of Complex Trauma, we can offer an additional master class after the conference. The participants of the master class will be able to feel the therapeutic effect of biosuggestion on themselves, not only theoretically, but also practically. And now we will offer you an online meditation of biosuggestive therapy.
Usage of biosuggestion online. During this session, you will hear special phrases that the therapist's spell touches certain parts of your body. Through the internet, we don't have the opportunity to touch the client. So how does the principle of this method works? The principles are following.
According to the research of Linköping University, Sweden, our brains seem to reduce sensory perception from an area of our skin when we touch it ourselves. A systematic review and multivariant meta-analysis of the physical and mental health benefits of touch interventions claims that comparing the different types of touches explored across studies didn't reveal significant differences in effect size based on touch type. This suggests that touch types may be flexibly adapted to the settings of every touch intervention. Overall, touch interventions were beneficial for both physical and mental health. These statements are confirmed by computer tomography of the brain. So, in our practice, we follow the algorithm that when a person touches another person, the areas of the brain that respond to touch are activated in the person being touched maximally by 100%. When a person touches himself, his brain reacts minimally by only 10%. There is no danger, so there is no big reaction. But if the person imagines that someone else is touching him, the areas of his brain that respond to touch are activated approximately by 60–70%. So when we conduct therapeutic meditation online, our words, our suggestions influence clients in the same way as in offline therapy session. But the effect of virtual imaginary touching influences them by 70% approximately. So it is enough for effective therapy if the client just imagines that the therapist is touching him. And now, we offer you an online session of biosuggestive therapy meditation. Find a comfortable position. Try to completely relax. Now, I will guide you through a therapeutic relaxation session, which will help you to feel better. You may keep your eyes open, although it will be easier to relax if you close your eyes. So, close your eyes. Don't be concerned that you will accidentally fall asleep with your eyes closed. You will not. Even if you feel somewhat sleepy, you will be able to hear my voice clearly, and you will be entirely aware of your body. And now, I will begin our healing session. Now, your body is still. You can hear my voice clearly, and you can hear the music as well. You can feel or imagine that I touch your forehead lightly with my hand. After a while, you will begin to feel a slight warmth from my touch on your forehead. This warmth is barely noticeable. However, it is having an effect. It is an invisible infrared extension of my biofield. It activates the self-regulation processes in your body. You might feel various sensations during the session. However, nothing unusual. This is normal. The effectiveness of our session is independent from what you feel or don't feel. Your body is continuing to receive a therapeutic effect from the session. Light warmth from my palm is penetrating every cell of your forehead and moving further and further, permeating every cell of your nervous system. You may or may not feel this. At the same time, your nervous system is becoming stronger. Calmness and serenity surrounds you. Calmness and serenity. Your brain cells are revitalizing. Every cell in your nervous system is getting sufficient amounts of oxygen, energy, and nutrients. Your conscious and present state is becoming more balanced, confident, and clear. Your brain function, memory, and mood are improving. This time is yours. It belongs only to you and your health. Now, you don't need to move or to think about anything or to make plans for the future. Focus your attention on your body. You are becoming more and more relaxed. Pleasant heaviness, tranquility and calmness surround you. Rest now. Rest now. Rest now. And now, I am directing the therapeutic effect on your neck. You can feel or imagine that a slight warmth from my palm wraps around the neck area. The blood supply to your neck muscles is improving. Your lower neck vertebrae are becoming more flexible. The physiological processes in your thyroid gland, larynx, and trachea are normalizing. Now, please bring your focus to your chest. Focus on your breathing. Breathing in and breathing out. The movements of your chest continue steadily. day and night, every moment. Sufficient oxygen enters your lungs as you are breathing. Feel the freshness of the air you inhale. Feel how pleasant it is when the slight coldness coming through your trachea and then into your chest. As you exhale, the gentle cool air is disappearing and the pleasant warmth is replacing it. The air comes in and goes out, comes in and goes out. Your body is becoming more and more relaxed with every exhale. The air comes in and goes out, comes in and goes out. You are breathing freely. Your lungs are functioning normally. Your heart is receiving enough blood, oxygen, and energy. Your pulse is regular. Your blood pressure is becoming normal. Physiological processes in your upper back are rejuvenating. Good. All right. Have a rest. Rest now. A variety of thoughts might appear in your consciousness. Some of them might be pleasant, and some might be sad. However, they are simply thoughts. If any thought distracts your attention, you don't need to drive it away or try to free your mind from it. Just focus your attention on your breathing. The air comes in and goes out, comes in and goes out. If you are distracted by any sounds or sensations, ignore them. Concentrate on your breathing, breathing in and out, in and out. The air comes in and then fades away, comes in and fades away. All right. Rest now. Rest now. Now, turn your attention to the center of your abdomen. Here is the solar plexus. From this point, vital energy is passing to your stomach, intestines, liver, bile ducts, pancreas, and spleen. Our session is already beginning to have an effect. Your digestion is normalizing. Your metabolism is improving. The therapeutic energy is passing into your kidneys, urinary tracts, and reproductive organs. Everything in your body is functioning rhythmically and steadily. Physiological processes in the lower back are normalizing. Your hormonal system is functioning well. Your immune system is getting stronger. Your blood circulation is improving. All physiological processes in your body are functioning properly. Good. Very good. Rest now. Rest now. Now, I am directing the therapeutic effect to your hands and legs. After the session, you will notice that your muscles and joints have become more flexible, pliable, and mobile. They have recovered. A pleasant feeling of vitality and usefulness returns to your body. Your body is becoming light and weightless, light and well rested. Your breathing is even. Your pulse is regular. Your body is relaxed. You are peaceful. Your thoughts are flowing smoothly, effortlessly, and freely. A sense of calmness and lightness surrounds your soul and your body. This pleasant feeling is seeping through every cell in your body. Now, I will start counting from 1 to 5. With every number, you will gradually feel full of vitality, refreshed and light. When we reach 5, our session will be complete. 1. Your body is totally filled with energy and health. You will retain this state and feel healthy and strong, healthy and full of vitality for a long time after this session. Just trust yourself. Everything will be all right. 2. all your organs and all the cells in your body are full of energy and health. You are peaceful and well balanced. Three. Gradually, you may start moving your body when you want to. You can change your position and open your eyes if they were closed. With every second, you feel more and more light and refreshed. You come back to right here and right now, but you come back as a different person, full of health, energy, and optimism. 4. Your body is light and well balanced. Every cell of your body is full of energy and health. 5. Everything in your body is functioning regularly, rhythmically, like a good clock. Your mind is clear, fresh and bright. Your body is light. Our session is over, but you will remain in a good mood and you will be feeling well for a long time. Be healthy and be happy.
My dear colleagues, thank you for your attention.
Hope to see you again.